There's so much going on about the coronavirus or COVID-19, whatever you want to call it. Since last we spoke, there have been emergency declarations by the president, by the governor, as well as by City Manager Augustus. And why is all this happening? Well, what we are doing is really learning on the job, watching Europe and Asia go through their version of this pandemic. And what we've been seeing is making us concerned that our country is on the same kind of trajectory as Italy. Now, Italy started out with some travelers that had come back from China and some of the countries that we had forbidden travel from, and they started an outbreak in northern Italy that has now spread all through Italy. And the issue is that it spread at such a pace that the virus has kind of overwhelmed the medical system. The medical system there had X amount of beds and X amount of ICU beds, and in those ICUs they had X amount of ventilators, the thing that help you breathe when you lose the ability to breathe on your own. And that's what we're trying to avoid here. So Dr. Fauci, who many of you have seen on TV, the brilliant virologist and infectious disease doctor from the National Institutes of Health, who has really become the point person for the federal response to this virus, has indicated that he sees this as kind of a humpback camel kind of a curve. He sees in Italy the curve that went up to the maximum amount of sick people was very, very steep and got to a point where it overwhelmed the system. So what he has been trying to advocate for, along with a lot of other very, very smart epidemiologists and public health advocates, is to blunt that height and blunt the slope of the curve. And that's why we're doing all of these things, like shutting down schools, stopping visitation in nursing homes, shutting down restaurants except for takeout, and doing the kind of things that we call social distancing, where we're recommending that people, if they can possibly self-isolate themselves or avoid contact with any groups bigger than 25 number, or do work from home on their computers. All of these things give us the possibility of making the slope of the curve less steep and the amplitude, the height of that peak, much lower. If we can spread this out in a more gradual fashion, the peak will come down. Nobody knows how fast the peak will come down, but we will get through this thing. But we will do it in such a way that we don't flood the system. And the medical environment is very, very worried about this now. We're worried that medical providers are going to get the disease and have to come offline, and then we're going to have to find replacements for them. We're worried that a lot of people who get worried at home about having this virus will come in unnecessarily, ask for testing, and the testing will really just put them at more risk for getting exposed because they're coming to the hospital. So it's a very, very difficult balancing act that all of us are trying to work through. We're not trying to be mean, we're not trying to ruin people's lives, we're not trying to take away their livelihoods. We're trying to really do the greatest good for the greatest number.
Stay tuned for more updates on virus prevention and visit the website for more information.